Hey everybody, I'm joined here today with Dr. Vida over at Water's Edge Medical Clinic and Spa. You can find them at watersedgemedicalclinic.com. And so we're here to talk about some of the most common types of pain that patients experience and the main treatments that are available today. So doctor, thank you so much for joining us today. I really appreciate it.
Yeah, I'm really excited to be here.
Yeah, absolutely. And yeah, I wanted to just start off by asking about your experience working with these patients and what got you interested in being able to help them, with their pain and with these treatments.
So I've actually been working in medicine for over 30 years. And I started seeing when I started in practice that not everything would help patients. People were struggling a lot with pain, neuropathy, and there really weren't very good solutions other than medications or surgeries or really harsh steroids. And so the orthopedist that I worked with, he and myself, we were always looking for other options. And we were fortunate enough to find regenerative medicine. And so we started with platelet rich plasma therapy, and then we started doing amniotic tissue, and then we moved into stem cells. And we've just seen such improvements with it. And so the patients, we just started seeing better results for it. And so once we started, we never looked back. And we started seeing that patients were just getting such better results with what we were doing. And so that's how we got into it.
Yeah, and can you explain really the difference between regenerative medicine versus, what people might be more familiar with, which is, just medication management for their symptoms and then
Sure.
ultimately surgery if it gets to that point?
Yeah, and you absolutely just said it. Other therapies are really just handling the symptoms, right? It's just kind of going in there and helping maybe calm down some of the pain. Most of the patients that we run into say, I'm taking the medications and I'm still having the pain. Or they'll go in and have surgery. Now, we're not opposed to surgery because in certain situations you have no choice. If you've torn your ACL in your knee, if you've torn your rotator cuff, yeah, that's what we need to do. But if your injuries are not such a severe, drastic injury like that, and it's more a chronic problem, regenerative medicine is so great with it because it's actually going in there and it's renewing, repairing, and regenerating that damaged and affected tissue. And so, one of the biggest things that I see the difference between regular medicine, we call it degenerative medicine because you're aging and it's degenerating. Regenerative medicine is actually changing it, it's regenerating those affected tissues, and it's waking up more stem cells within the body itself to allow for healing to occur. Or even if we're doing PRP, it's waking up platelets and allowing the body to self heal. It's giving it tools to actually heal itself. So that's why that's the main differences that we see between regular medicine with medications versus regenerative.
Awesome. Yeah, that's really exciting. And are there kind of main or really common types of pain or areas of pain that you're able to help treat with doing those with those treatments?
So regenerative medicine has come a long way. We first started out with joint pain. If somebody came in with like an arthritic joint, so we could do any joints pretty much in the body, the knees, the shoulders, the neck, the back, hands, elbows, you name it, any joint. Then we started working more with patients with neuropathy, more intense type of issues and problems. And that's usually what we stick with. There are a lot more people that are starting to look at, more for enhancing the immune system, more for helping things like Lyme disease and even other problems. But in our clinic, we're really more so focusing on the joint pain and neuropathy. But it definitely is the wave of the future. We know how well it works for that. But I know as everything's progressing, and even with AI and all the advances we have, eventually, hopefully, we'll be able to treat all sorts of ailments and issues, from autoimmune disorders to any kind of chronic problems, which would be
Definitely.
amazing.
Yeah. Well, I think it just goes back to what you mentioned there. It's using the body's own, natural healing process to really target those specific areas. So
Uh,
yeah, I think it's
yeah,
definitely.
which is so amazing, right? I always joke with patients. I always tell them I'm 105 years old.
that's awesome. Yeah,
Yeah.
and, with the treatments that you do, what are some of the main ones that you really focus on for, joint pain and some of those different ones that you mentioned?
So we like to do a combination of treatments for our patients when they come in for joint pain, or even neuropathy. We have found that, a lot of times just doing something like stem cell therapy isn't enough. So a lot of times we will combine several different products, and it could be exosomes, it could be stem cells, it could be PRP, depending on the damage that's happening. A lot of times we'll use more of the lower level regenerative products like PRP, or even connective tissue products, more so for inflammation, for soft tissue issues. We'll use stem cell if the person has more degenerative changes like arthritis. But when we use the combination, one might increase more inflammation and get more blood into that area. The other product will work more on regenerating the affected area. And then with all that, we love to combine our soft wave. We have kind of like a shock wave machine or device. It's called the soft wave. And that actually will help your own body stem cells wake up within 45 minutes of the treatment. And it also does what we call angiogenesis, which is the formation of new capillaries. So it's allowing that area to heal even more. And the other thing that we found is when we do the soft wave treatment after the person has gotten a stem cell injection, it will actually help replicate those stem cells even more. So it's making that treatment even more effective. So very rarely do we get a person who just gets something like stem cells. We'll usually do a combination of treatments to get the best results for them.
Yeah, yeah, that's awesome. And I know with some of those more traditional forms of therapy, there are a lot of side effects and pain associated with them typically, especially, surgery if it's not really addressing that
Sure.
root cause. Is there any side effects or pain associated with doing the treatments that you were talking about?
So, side effect wise, the only side effect I've ever seen in working with regenerative medicine now for almost 20 years, the only thing I've seen is if a person has gout, they can inflame, and gout can just all of a sudden just wake up and be affected throughout the body. That's really the only thing I've seen. And in regard, like for side effects, so that's it. And pain, well, it's an injection. So injections hurt a little bit. I always tell patients you need about 30 seconds of courage. We do use a cold numbing spray so that you don't really feel that much pain or discomfort. And when we talk about downtime, surgery downtime could be months.
Yeah,
Usually we'll tell patients take it easy for 48 hours because you've got a little bit more swelling in that area from the injection itself. But usually patients can start doing some light activity pretty quickly. So it's pretty amazing how fast, very little downtime, almost no side. I haven't seen any side effects, no rejection or anything of that nature because those cells are so pure. It's not affecting. There's no need for matching.
right.
So really amazing type of technology and treatment.
Yeah, absolutely. And who would you say is really somebody that's a good candidate for those treatments?
You know what? I have done. We have done regenerative medicine on as young as athletes being 13 years of age to as old as 99.
Oh,
Yeah. So anybody who's really suffering with joint pain and neuropathy, it is so effective. I even when my daughter was 13, I actually did a treatment for her. She had a terrible Achilles injury where she bruised several bones in her foot, as well as kind of she didn't tear the Achilles, but she had
mm,
some pretty severe damage and inflammation in there, and she could barely walk. So we did a regenerative procedure for her. Um, at 13 years of age, she was petrified, but we did it, and literally within like 4 days, she was running around like nothing ever happened.
no kidding. That's
The beauty
crazy.
of being 13 and getting regenerative medicine is pretty amazing.
Yeah.
Yeah. So
That's awesome. And,
yeah.
along with patients, I know I'm sure it varies a bit, kind of what the severity of the issue was or the injury. How long does the pain relief typically last on average? And do you recommend, any other type of treatments or kind of maintenance to really get the most out of it?
Sure. So what we find with if they're doing something like a stem cell therapy, those cells are going to continue to self-replicate, continue to keep working, fixing that area for up to 2 years. I have seen patients after stem cell therapy, some patients, depending on the amount of degeneration, they might be good for a year, maybe two. And then I've seen others that have been good for like 10 years without needing any additional therapies. Now, it obviously depends on the amount of degeneration, the amount of damage, and it also depends on the health of the patient. If I get a patient who isn't taking a lot of medications and who eats really healthy and who is taking care of themselves, they'll respond better to somebody who is on a lot of medications and has had a lot of injuries. So when we look at results, most of the time patients will be good for a couple of years. And a lot of times that's just from one injection. So we do pick and we do look and we are very honest with our patients, especially when we look at images and we do give them, you know, it might only last for 6 months. I've had several patients come in whose knees were really, they're really surgical candidates and they just were not mentally ready to have something like a knee replacement. We ended up giving them stem cell therapy and it held out for a year for them. They got mentally ready. And what was the best part is when they did have the surgery, because they did have that regenerative product in that area, they healed from their knee replacement twice as fast.
Wow.
Yeah. So
That's
that's
awesome.
the beauty of it. Mm-hmm.
Yeah, no kidding. That's awesome to hear. And
Yeah.
what would be the best way for patients to get in contact with you if they wanted to come in and have a consultation with you?
Yeah, so we actually are offering a free consultation and evaluation for patients. They can actually give us a call. Our phone number is 727-550-0855. They can also go to our website, the www.watersedgemedicalclinic.com. I do have a little link in there where they can, put in their name and information, and we'll be able to contact them directly. And even one of our great specials, when they come in for that consult and evaluation, they can try our soft wave therapy for $49 to see if it will help. Soft wave is sometimes covered by insurances. So we always tell patients, make sure when you come to the office, we do have some things that are covered by insurance. So please bring your insurance. We will verify it for them to find out. But yes, we do a free consultation because if we can't help you, we'll see. We'll do what we can to see where else we might need to send you. But we're pretty straightforward, honest, and our main goal is to help people.
Definitely. Yeah, I can definitely appreciate that. All right, awesome. Well, I love the work that you guys are doing there. Was there any last advice or anything that you have for patients if they're maybe struggling with these type of pains or if they're just not sure if regenerative medicine is going to be a good fit for them?
Yeah. So for me, I always tell patients, if you're starting to have pain, it's so much easier to fix a problem when it's not a major problem.
Right.
So the tendency that we have to do as people is a lot of times we'll be like, oh, it's not so bad.
Mm.
And we always kind of minimize it, or we're concerned about everybody else and we put ourselves last. And unfortunately, when that happens, I mean, I've had instances where patients came and they were just too far degenerated. There was nothing we could do, right? We had to send them away and they had to get replacements or they had to have surgery. And so I always tell patients, don't wait. Get it handled because it's so much easier to handle it. And then you can go on and live your life and feel great. I mean, I did it myself. I actually I was a collegiate tennis player and I really injured my shoulder and I suffered for 10 years because I'm afraid of needles, right? And I refused to get an injection because I was so afraid of needles. And finally, my son pretty much told me, Mom, this is ridiculous. Go get stem cells.
Yeah.
And I had stopped playing tennis for 10 years. I had severe pain in my shoulder. It woke me up every night. I got the stem cell injection 3 weeks later. All of my pain was gone.
Wow.
And I suffered for 10 years. And my son looked at me and goes, Mom, I told you so.
Yeah.
Um, and so that is my advice to patients. Don't suffer. Like, come in. Let us evaluate you. Let us see if we can help you. It's really worth it.
Yeah,
It really
absolutely.
is.
Yeah,
Yeah.
well, that's a huge case study, and that's great to know that you were able to get the relief from that even after all of that time of dealing with that, so
Yeah. Yeah. And I kick myself because I'm like, God, I could have had 10 years, playing tennis and still enjoying life. And instead I stopped, because of the pain. Now, believe it or not, I can play and I do play on occasion, but I'm too busy treating patients to be able to go out and play. But too busy helping people. That's the
yeah,
whole goal.
um,
Yeah.
well, cool, yeah, well, I love the work that you guys are doing there, and I really appreciate you taking the
Thank
time to talk
you.
with us and share the education on those treatments, so thank you for doing that.
Thank you very much. Yeah, and I'm very appreciative to be on this call, so I appreciate it as well. Thank you so much.
Yeah, of course. Alright, well, thanks again.